Hi, thanks so much for joining our presentation on paid family medical leave. My name is Amie Sherman. I'm the HR director here at AllMed Staffing. Let's get started. Paid family medical leave in Maine starts this month. And a quick summary, you are familiar with FMLA. PFML is very similar, and it runs concurrent with family medical leave. Workers who have worked a qualifying amount of wages in the previous 5 quarters are eligible to receive paid benefits. Who is affected? Any workers in Maine who have made more than $7,188 in the first 4 of the last 5 quarters. Family of workers who will need to take time off for a qualified need. What this is workers must file a claim on their own using a link provided by the employer. Workers can be paid for up to 12 weeks per year at a percentage of their normal wages. When this takes effect, April 1st of 26, claims can be submitted, and May 1st of 26, the first claims can be paid. Meet our team here at AllMed. Our executives are the administrator, Danielle Charles, the home care manager, Nate Charles, HR director, Amie Sherman, and our payroll, Alyssa Lawler. So who can take paid time off? The eligibility criteria is that employees must meet an income requirement of $7,188 in the first 4 of the last 5 quarters, also called a base period. And they must have worked for the employer for at least 120 days. Reasons for the leave have to be either medical leave, when a serious health condition prevents you from working; parental leave, time to bond with a child after birth, fostering, or adoption; family care leave, time to care for a loved one with a serious health condition; military family leave, giving the family time to prepare for a member's deployment; and safe leave, to find safety after abuse or violence. How to access these benefits? You will head to the portal. This is available 24/7. You register with your social security number, and these benefits are portable, meaning if you worked for another employer in the past year, we will calculate the benefits according to all of your wages in the past 5 quarters. So review the poster. This has instructions on how to file. This is all based off of a number that the state has acquired, also called the state average weekly wage, which is $1,198. If an employee makes less than half the state average weekly wage, this lays out examples for each one of these. So if an employee is at less than half and they made, for example, $15,600 over the base period, they would have an average weekly wage of $300 per week. They would receive 90% of their wage during their benefit period, or $270 per week. If the employee makes more than half the state average weekly wage, for example, $57,000 over the base period, they would have an average weekly wage of $1,096. They would be eligible for the first $599 at 90%, and then the remaining $497 would be at 66% during their benefits, equaling $867 per week for that particular example. The highest amount an employee can get in the paid family medical leave benefits is coincidentally the same as the state average weekly wage of $1,198. So if an employee makes $90,000 in the base period, they would qualify for $1,285, but that would be scaled back to the maximum amount, which is $1,198. The milestones for the state of Maine and these benefits are 4/1 of 26. The portal is open for claims. As of May 1st, this is the first possible day of a paid claim. 90 days is the amount of time that you can put in your claim for a planned absence. 30 days is the minimum number of days an employee must notify their employer for a planned absence. 120 days is the minimum number of days an employee must be with an employer to fall under these job protections. And 12 weeks is the maximum amount of time an employee can take in their benefit year for paid family medical leave for qualified reasons. What is a benefit year? The benefit year depends on when you take your leave. An employee's benefit year is a 52-week period beginning on the Sunday prior to when their leave starts. So if you're taking leave this week, your 52-week period would restart on April 5th of 2027. Paid family medical leave benefits run concurrent with family medical leave, meaning that you don't get both family medical leave and paid family medical leave. They run at the same time. So, for example, if an employee had taken FMLA in January of this year, that is when their benefit year would start, and it would have run down the number of weeks that they have for eligible benefits in paid family medical leave. Things you can provide to your employer to make sure your claim goes smoothly are the types of leave, whether it be family leave, medical leave, safe leave, or situations related to a family member's upcoming deployment, the dates of the leave and the documentation from the medical professional, and the frequency of the leave. Will it be continuous, intermittent, or in the form of a reduced schedule? Of course, situations happen, and if an emergency arises, the employee must give notice to the employer as soon as practicable under the circumstances. Notice must be given in writing, which can also include an email or text to the employer. Notice can also be given to the employer through a family member or healthcare provider. Another part of this is the option to top off your benefits. If you have paid time off with your company, you're able to request the company to add paid time off to top off your benefits, so you receive 100% of your regular wages. It's the employer's job to make sure you don't receive more than your regular paycheck during this time. There's also proration for a partial week. Employees can apply for time off in the form of a reduced work schedule if needed. This accommodates for appointments. The program accommodates needs to attend appointments as needed with an approved claim. And remember HIPAA, while your employer needs a medical note to approve your claim, you do not share specific health information with your employer, only the reason for the time off. You should be so proud of what you do as a caregiver here for AllMed staffing and all caregivers. We respect your work matters so much. A caring heart, capable hands, and incredible courage is a way that we think of our company. And always remember, kindness is a language which the deaf can hear and the blind can see. Thank you so much for attending our April training on paid family medical leave. Have a great day.